Imagine this. You've just spent 6 months leading a team to build the perfect predictive analytics dashboard. It is a thing of beauty. The backend is flawless. The data pipeline is clean. It's pulling real-time vitals, lab results, and historical trends. It's got slick visualizations that would make Tableau's Zen masters weep with joy. You finally get 15 minutes on the agenda at the clinical leadership meeting. You proudly present this glorious masterpiece to the chief medical officer and the head of nursing. There's silence for about 10 seconds. And then the CMO squints at the screen and says, "Okay, that's a lot of colors, but does this help me decide if Miss Johnson in bed 4 is ready for discharge today, or do I still have to open 3 different tabs in the EHR to figure that out?" And just like that, all the air goes out of the room. If you work in healthcare IT, informatics, or digital health strategy, you have felt this specific type of pain. The gap between brilliant technology and actual clinical adoption isn't a technical problem. It's a translation problem. And today, we're discussing the single most important soft skill in our industry, translating data into doctor. We're going to talk about the executive-level mindset shift required to stop building shelfware and start building tools that clinicians actually use to save lives. Let's dive in. I have spent over 15 years sitting in that awkward space between the server room and the clinical space. And if there is this one universal truth that I've learned, it's this. Technology is not their number one priority. The patient is. And frankly, technology isn't even number 2 or 3 either. It's usually way down on the list right after finding a working pen and getting a bathroom break before noon. As IT professionals and data leaders, we love complexity. We respect robust architecture. We love seeing the how of the data. Clinicians, they are operating in a high-stakes, time-starved, cognitive load nightmare. They don't have the bandwidth to respect your architecture. They don't have 20 minutes to learn a new interface just to do something they used to do in 2 minutes on paper. To find real success in the health IT landscape, you have to accept a really harsh reality. If your brilliant technology adds friction, you are the enemy. The secret sauce to adoption really isn't features. It's simplicity. It's about taking massive technological complexity and distilling it down into something so digestible, so intuitive, that it feels invisible. So, how do we do that? We need to master 3 specific translation techniques. The first technique is what I call the so what test. Data scientists and IT folks love showing their work. We tend to present data like this. Here are 42 variables that correlate with sepsis risks, weighted by these factors, displayed in a heat map. And the doctor is really looking at you thinking, so what? What do I do with this information right now? Clinicians are trained in a binary world of action. Treat or don't treat, admit or discharge, order the test or don't. To translate data to doctor, you must move from displaying information to prompting action. Don't show them a dashboard with 1,000 data points on readmission risk. Show them a list of 5 patients on the floor today who need a specific social work consult before they leave. The right clinical IT mindset means you don't burden the end user with the analysis. You do the heavy lifting on the back end, so the front end is dead simple. If the data doesn't directly answer the question, what do I do next for this patient? Hide it. It's just noise. This leads to the second translation technique, workflow integration. Nothing kills adoption faster than click fatigue. If your new tool requires a clinician to log off the EHR, log into a separate web portal, remember another password, and then search for the patient again, congratulations, you've created work more, not workflow. I don't care if your algorithm can predict the future with 99% accuracy. If it's outside their natural path of movement through the digital chart, it won't get used. The soft skill here is empathy through observation. You cannot design clinical tools sitting in an IT office. You have to go and do rounds. You have to watch a nurse doing intake at 3 a.m. during a shift change. Doing this is where I learned the value of a great pair of comfortable shoes, because hospital corridors are long. What you have to do is you have to identify their existing friction points and insert your technology as the lubricant, not a speed bump. If you're asking them to change their behavior to accommodate your technology, you have already lost. Your technology must bend to accommodate their reality. This is the truth in the clinical space and IT. And finally, the third technique, and this is pure soft skill. You have to stop speaking technical and start speaking clinical. When you are trying to get buy-in from hospital leadership or frontline staff, nobody cares about your Hadoop cluster or your FHR API integration standards. They care about decreasing length of stay, reducing hospital-acquired conditions, improving patient satisfaction scores, saving nursing hours per shift. Instead of saying we're implementing a new NLP engine to parse unstructured nodes, try saying we're rolling out a tool that automatically highlights medication allergies in the free text so you don't miss them during a hurried admission. See the difference? One is about the tech, and the other is about patient safety and having the clinicians back. Now, to really win here, you need a translator on the inside. Find a clinical champion. Find the one doctor or nurse who is slightly geeky, respected by their peers, and tired of the status quo. Win them over first. Let them explain the value to their colleagues. A doctor will listen to another doctor way faster than they will listen to the IT director. So, let's summarize. We're moving into an era of healthcare where data is abundant, but usable insights are scarce. And many health companies are just chasing the next innovation. If you want to be successful in this field, you have to realize that your job isn't just to manage data. Your job is to manage the relationship between data and the people who use it to save lives. It is hard work. It requires swallowing your pride when they reject your complex dashboard in favor of a simple checklist. It requires going above and beyond to break down barriers and make things painfully simple. Because remember, they don't have time to learn your system. They're there for patient care first and foremost. So, here's my challenge to you this week. Look at a project you're currently pushing to clinicians and ask yourself the really hard questions. Does this pass the so what test? Is it integrated into their workflow, or is this work more? Are you selling the technical features or the clinical value? If this video brought you value, please hit that like button. It's the best way to let me know that this kind of content is valuable to you and you would like to see more. And if you want to keep elevating your perspective on strategy and leadership, consider subscribing to the channel. I also want to hear from you in the comments. What's the biggest barrier you faced when trying to get clinicians to adopt new tech? Let's start a discussion down there. And thanks for watching.